Dogworks Radio is sponsored by Alaska Dogworks. Check out their website at alaskadogworks.com.
You can support this podcast on patreon.com/firstpawmedia.
Did you know that there is a blood bank for dogs? I'm not sure they will receive orange juice and cookies like we do at the American Red Cross, but it is still something to think about for your dog, especially in times of emergency, disease, or illness. This is a topic that we covered way back in the first few episodes of the podcast more than a decade ago, and researching it for today's show finds that it is still a highly searched question on Google. Let's talk about canine blood donation, shall we?
From First Paw Media, sponsored by Alaska Dogworks Professional Canine Training Center in Anchorage, Alaska. This is Dogworks Radio, committed to families and their dogs to build lifelong and fulfilling relationships. Visit our website at dogworksradio.com. Now here are your hosts, Robert and Michelle Forto.
Hello and welcome to Dogworks Radio. I'm your host, Michelle Forto, and I'm also the lead trainer of Alaska Dogworks, where we help you have a better relationship with your canine buddy. Did you know that there is such a thing as a blood bank for dogs? We're going to talk about it on the show today. Veterinary medicine is becoming increasingly sophisticated and offers innovative and exciting ways to prolong and enhance the lives of our canine companions. Medical procedures and surgeries such as emergency and internal medicine, critical care, oncology, and orthopedic and soft tissue surgery are on the rise. As a result of these advancements, the demand for canine blood transfusions has increased sharply. As such, canine blood donation has become more imperative and topical than ever. The development and maintenance of canine blood banks is a relatively new phenomenon, as are efforts to make blood products widely available to veterinarians. Before regional canine blood banks, veterinarians whose patients required blood had to rely on their own dogs or those of a colleague or client. While there are a few national animal blood banks, the ever-increasing need for canine blood and blood products has resulted in several regional programs, including banks in Maryland, Florida, Michigan, Texas, Colorado, California, Georgia, and Pennsylvania. Canine blood banks, much like human blood banks, rely on the generous donations of volunteers who meet blood donation requirements. Some regional blood banks, such as California's HemoPet, rely on resident canine donors that are housed in on-site kennels. Often, resident canine donors are retired racing greyhounds and dogs from local shelters who would have otherwise been euthanized. Other regional blood banks, including the University of Pennsylvania's Penn Animal Blood Bank, or PABB, utilize their own blood mobiles, which are used for blood drives from veterinary hospitals and breed and other dog clubs. According to the National Canine Cancer Foundation, there are essentially two types of blood donation programs: full pint and half pint. While dogs of various sizes and breeds can meet donor requirements, their weight determines which donation program they'll be placed into once they meet the basic behavioral and health criteria required of all donors. All prospective canine donors must be calm, friendly, and obedient. Donors should also be receptive to strangers, cooperative or without their owners present, and comfortable being handled physically and examined. Like their human counterparts, to be eligible to donate blood, dogs must be in general good health. To this end, Donors must be current on their required vaccinations, including distemper, parvovirus, parainfluenza, hepatitis, and rabies. They must also be free of any medications other than flea, tick, and heartworm preventatives. Dogs who have received blood transfusions and or those with heart murmurs or other cardiac conditions are ineligible to donate blood. For female dogs, some programs include no history of pregnancy in their eligibility requirements. Age and weight requirements vary slightly from across programs, typically ranging from 1 to 9 years of age and 35 to 50 pounds or more without being overweight. After meeting the basic requirements and before the donation process is underway, dogs are given a complete physical, blood chemistry profile, and complete blood count. Prospective donors are also screened for other possible conditions like brucellosis, Rocky Mountain spotted fever, and Lyme disease. The procedure of canine blood donation is a simple and straightforward process. Blood donation typically lasts between 15 and 30 minutes. Dogs are gently placed on their sides atop comfortable bedding and soothed while the area on and around their jugular vein is cleaned and prepped. Once the area has been sterilized and, if necessary, clipped or shaved, blood is then drawn through a needle into a sterile collection set. After the blood has been collected, dogs are given belly rubs and edible treats and or IV fluids to help hydrate and replace blood lost during the procedure. They also sometimes receive bandanas, ID tags, collars, or toys. Once the blood has been collected, it is spin processed in a centrifuge and separated into components. White and red blood cells, platelets, and plasma comprise canine blood. The most common canine blood transfusions utilize red blood cells and plasma. Each blood component has its own unique healing properties. Red blood cell transfusions are useful when treating anemia, cancer-related blood loss, and to supplement the body's waning production of red blood cells because of illness, such as bone marrow disease. Plasma is rich in anticoagulants and proteins. As a result, plasma transfusions are used to treat ailments such as internal bleeding, deadly canine diseases such as parvo, inherited bleeding disorders, and hemophilia. Just as people have blood types, so do dogs. Rather than blood types, however, canine blood varieties are commonly referred to as groups. Dogs have over a dozen different blood groups, 6 of which are common. Both humans and dogs can be classified as universal donors based on their type or group. Roughly 40% of dogs belong to the universal donor group. Blood from dogs belonging to the universal donor group is compatible with any prospective recipient's blood because dogs, just like humans, can suffer adverse reactions to transfused blood from dogs with different types than their own. Dogs with the universal blood group are ideal donors. The benefits owners receive from enrolling their pets in blood donor programs far outweigh any disadvantages. Some canine donors, like humans, may experience soreness or minor swelling at the site, yet most can resume their normal routines within a day of donating. In addition to the personal satisfaction owners likely receive from knowing their dog's blood donation will help save other dogs' lives, owners often receive tangible benefits as well. Owners often save on preventative care or receive reimbursement toward future care. They also benefit from extensive blood screening and typing. These procedures are otherwise expensive and offer owners valuable medical information about their pets, which could be useful or necessary in emergencies. Furthermore, many blood banks offer owners free food, veterinary services, and free lifetime blood transfusions for the donor and or other pets in the donor's household. While canine blood donor requirements vary across states and programs, the need is constant. Canine blood donation benefits both owners and canine recipients. If owners are interested in possibly enrolling their pets in a blood donation program, they should contact their local veterinarian, veterinary school, or emergency veterinary clinic for more information. So what do you guys think? Would you ever think about donating your dog's blood to help during an emergency? Let us know in the comments or over on our social channels. Just search DogWorks Radio. And one last thing. Did you know the best thing you can do for our show is to tell your family and friends how to listen? Who knows? They just might become a rabid listener just like you. I'm Michelle Forto for DogWorks Radio and First Paw Media. See you next time.
From First Paw Media, this is DogWorks Radio. We hope you enjoyed this podcast, and we invite you to subscribe in Apple Podcasts, Spotify, Stitcher, or wherever you get your podcasts. You'll find a link on the episode notes. You can tap or swipe on the episode cover art, and you'll see some offers from our sponsors. You can support our show by supporting them. If you like what you have heard, we would love it if you could give us a 5-star rating and tell your friends how to subscribe too. Your hosts are Robert and Michelle Forto. Our producer is Robert Forto and created for First Paw Media.
Did you know that Alaska Dog Works trains service dogs for those in need throughout North America? Each and every service dog that is trained through the Lead Dog Service Dog Program and Michelle Forto and her team has an individual training plan. We train for autistic, mobility, psychiatric, and PTSD for our soldiers for service work. If you know of someone that may need a service dog, please take a moment and check out Alaska Dog Works on social media and at alaskadogworks.com.